Atrial fibrillation, that is AF, is the leading cause of cardiac ischemia and stroke in India, affecting patients aged 45 years and above, which is 10 years earlier than patients in Western countries. Non-valvular atrial fibrillation, that is NVAF, is the most common form of AF affecting patients globally, with high rates of mortality in subjects with NVAF around the time of diagnosis. Non-valvular AF is associated with a 5-fold increased risk of stroke. The first-line therapies for prevention of stroke in non-valvular atrial fibrillation are anticoagulants, that is warfarin, direct thrombin inhibitors, etc. Warfarin used to be the anticoagulant of choice, but a meta-analysis revealed that 44% of bleeding complications with warfarin have been associated with supratherapeutic international normalized ratios, that is INR, and that 48% of thromboembolic events occurred with subtherapeutic INR. In an Indian study, INR monitoring was seen to be irregular in 25% of the Indian patients with AF. Traditional diet rich in green leafy vegetables is a rich source of vitamin K, which counteracts the effectiveness of warfarin. Furthermore, common OTC medications such as NSAIDs are known to interact with warfarin. Dabigatran is a novel oral anticoagulant, US FDA and EMA approved, and NICE, ESC, AHA, HRS and ACC recommended for prevention of stroke in non-valvular atrial fibrillation. Dabigatran is a direct thrombin inhibitor that prevents clot formation by inhibiting the thrombin enzyme that is responsible for converting fibrinogen to fibrin in the coagulation cascade. Dabigatran is safer and equally effective as warfarin for stroke prevention in non-valvular atrial fibrillation patients. In the RELY comparison trial with warfarin, Dabigatran 150 mg was superior in efficacy towards reduction of stroke or systemic embolism events. Dabigatran is also the only novel oral anticoagulant with a fast-acting reversing agent. Dabigatran is available in capsule form that can be consumed by the patient twice daily for prophylaxis. Unlike warfarin, it does not require INR monitoring. Introducing Afogatran, a brand of Dabigatran by Torrent Pharma, a sure and safer way towards anticoagulation.